What's up, guys? Dr. Mo here, digital nomad physician at digitalnomadphysician.com. It's been a while since I recorded a video. I am back in Santiago de Compostela dealing with some things as I come back here, renewing my visa, getting my car fixed. I have to do an annual inspection for the car. The battery died. I got to get a new battery. The AC is not working. I get the AC fixed. I have a car here in Spain. I don't have a car in the US. And that little fridge unfortunately died. And I talked to the technician today. He came by, he took a look at it, and he's like, no, it's not something we can repair. The way these things are made, they're made to be pretty much obsolete. And so he's like, I can't even open it up. There's a leak probably in the gas. Anyway, so those are the things I'm dealing with. So welcome to the channel. This channel is for physicians. It is mostly for digital nomad physicians, not a patient-facing channel. It's not a public-facing channel. It's mostly for those of us physicians who just want to do a little bit more with our medical licenses, with our expertise, with what we do. We want to be able to work remotely. We want to be able to start our own medical practices, businesses, everything. A little bit about me. I'm a family medicine physician. Live in Los Angeles, pretty standard lifestyle. I lived in Portland as well, and then at some point I decided to move over here to Spain part of the time, enough to not fall under the tax laws, but also enough for me to integrate here and buy an apartment like I did here and live here and speak the local language, Castellano and Gallego. But at the same time, I wanted to be able to work remotely in my businesses, be able to have some income. So some part of it is real estate, some part of it is investments, and the rest of it is some telemedicine, some healthcare consulting, some health coaching. So in that regard, kind of an interesting thing came up recently. So somebody told me, okay, I'm taking this course. I'm taking this telemedicine course. Great. By Scott something. I'll put a link here. I forgot his last name. He's an attorney. And apparently there are physicians who think that there are ways to get around the Medical Practice Act. So let's just do a quick overview so that everybody who's a physician can understand what the rules and regulations are when you're a physician in the US. First of all, the entire thing is highly regulated. If you claim to be a physician, if you act like a physician, if you use your title as doctor inappropriately, all of that can get you into trouble. Do people get into trouble? That's not the point. It doesn't matter whether somebody's going to, is there somebody who's actually actively going after people? It doesn't matter, because if it's you who ends up having to defend yourself in court, that's an ugly thing. You don't want to deal with that. So the practice of medicine is in a set of rules called the Medical Practice Act, the MPA, which every state adopts on their own in their own ways. And if you treat, diagnose, assess, or collect personal health information for the purposes of giving out personalized instructions to an individual, that is considered the practice of medicine. Done. End of story. Now, in some instances, it could be the practice of dietetics. It could be the practice of physical therapy, of chiropractic. So you can fall into different categories. But if you have an MD or a DO and you do anything like that without having a license, without having an active license, without being licensed in the state where you have to do it, it's illegal. It's illegal. It's blatantly illegal. So obviously the next question is then what is it that I'm doing? Because I'm doing something very similar to that. I'm doing health coaching. I'm doing telemedicine while I'm in another country, and healthcare consulting. Healthcare consulting is completely different. As a healthcare consultant, I am a health expert who sells my time to businesses to create algorithms or services for whatever the hell they want to do, from artificial intelligence to data analytics to everything else in between, to medical device companies. In fact, in many states, for that you still need an active medical license, believe it or not. So that's a whole nother topic. I'm not even going to get into that. So that's one part. That's health consulting. It has nothing to do with patient care or giving individual advice. So let's talk about this one in the middle, which is a health coach. I am a heart health coach. How can I be a heart health coach? How can I be a health coach for someone and not be a physician? So many health coaches definitely have a bad reputation out there in some spheres. As a health coach, somebody calls me up they pay me a lot of money an hour, and they say, all right, well, this is what I'm battling. I'm trying to decide whether I'm really at risk for this particular condition, or I'm overseas and I'm being told I should do this, or I'm the caregiver for my parent and this is what I'm doing. Number one, I tell them, you and I will not enter a patient-doctor relationship. Sorry for the noise outside. It's right around lunchtime. It is 3 p.m. So everybody's pretty much finishing up lunch in Santiago de Compostela. It's time for a siesta, about an hour. And then everything will get kind of busy again. And there's a beautiful, wonderful restaurant right outside my window. So I tell them immediately, you and I are not going to enter a patient-doctor relationship, nor can I give you individualized advice. And I always do that in my first free 15-minute introductory session. And if someone's like, oh, no, I'm looking for somebody to prescribe me medications or to give me very individual advice. Great, yeah, I'm not your man, and I can give you wonderful recommendations. So I have this auto-populated email. I'll send them all the list to all the cardiologists, preventative cardiologists, interventional cardiologists, internists, functional medicine doctors, integrative doctors, everybody I know that I've collected over the years who are going to be a great fit. What I do, if somebody comes with me, I just recently completed a call, and she, young actually, had a bunch of health concerns because of a recent cholesterol panel. So she asked me a bunch of questions, and I told her I can give you general advice based on what I have learned about the field of cardiovascular medicine. As a physician who's not your physician, I can give you general advice. So I told her, any information you give me is on your own volition. I do not collect it anywhere. I do not save it anywhere. I do not create a medical chart. All of that information is given. And obviously, she has to sign off on something before we engage in that conversation. But she told me her recent blood pressures, her weight, her cholesterol, all of that stuff. Great. And did you do this test? No. Did you do this and this test? Yes, I did. Okay. If you want to share that with me, you can. If you don't need to, you can screenshot it with me. You can send me a text message. And I reviewed that with her, and we came up with some decisions. And those decisions are not decisions I made for her or helped her make in any shape or form. It was, well, the next step in this would be to order these other tests if you absolutely want to know what else to do. However, in such a situation, the data shows very clearly that if you're not starting on some sort of a cholesterol lowering intervention, the chances of you having a cardiovascular event is high, especially because of the risk scores that we use currently with current risk calculators. And I have actually my own risk calculator that I've created, and I offer that as a separate service. So I told her we could always input her into that to figure it out, but it was already pretty clear. So she wasn't going to be a good candidate for that. And based on that, this is what I would do for my own patients. That's the information I gave her. It was great. And it went really well. It wasn't like she was really worried about it. She actually had one particular chronic condition, and it was nice for her to talk to me because I understood that chronic condition very well. It was an autoimmune condition. And that's it. That's the health coaching. As a health coach, I take and digest the vast knowledge of clinical information that we have, and I'm able to translate it for the patient here. That's it. That's all I do. I don't help them. I don't give them I don't tell them to take anything over the counter. I don't tell them to take red yeast rice or whatever that is. I don't tell them to change their diet or start a different activity level. I just share the information that I have. And the majority of it is mainstream information. I try not to get too much into the weeds. Like if you do 7-day fasting, you're going to be, I don't know, whatever that silly stuff is. Well, not silly, but not something that I believe in. So that's health coaching. And then there's telemedicine. So now, where is she located? She was actually not even located in the US. Well, she's from the US, but she was recently not in the US. But I can do that being in California, and she can be in New York. I can do that with me being in Spain and her being in Mexico. And that's not the same with telemedicine, right? If you are a telemedicine physician, you can get a telemedicine license, and I'm not going to go into the details. I highly, highly recommend this attorney's course that he's created. It's great. It's really good. It goes through a lot of stuff. I highly recommend his book, which I'll also link here, which I finished reading already. And basically, if you want to be a telemedicine physician, be a telemedicine physician. In fact, it might make your life a lot easier. You can say, I'm a family medicine physician focusing on cardiovascular health. And if she contacted me, she would still pay me the money. Of course, she would have to be in one of the states where I'm licensed, or at least be a resident if she's traveling abroad. And I don't bill insurance. I don't do Medicare, Medicaid. I don't do any of that. I don't want to fall into any kind of those little pitfalls that our healthcare industry has created. And that's simple. The telemedicine thing is simple. You should already know what that is. But to summarize it, if you are giving health advice, if you're giving individual advice, if you're giving lifestyle advice, if you're giving diet advice, if you're telling somebody they should sleep more, if you're telling somebody they should, well, no, actually that's not true. Certain things you can say that still would actually not fall into, if you diagnose someone, for sure you are screwed, that's it. If something goes wrong, if somebody reports you, if somebody finds your content, you can get shut down. So that's diagnosis. Even an assessment, as in it could be this, it could be that, it could be this, it could be that, you can't do that. Interpreting lab results, imaging studies, you can't do that. Telling somebody to take something over the counter, that's a little bit of a wishy-washy thing. Telling somebody to exercise, if the CDC, the WHO, the FDA, or any HHS, or any other patient-facing organization is giving that advice already and you just repeat it, that's not considered the practice of medicine, so that's fine. But if you tell somebody that they should take a particular supplement over the counter, that's actually the practice of medicine, because that recommendation is considered a prescription. Again, you may not get into trouble for it if you're not a physician. If you are a physician, the whole world's coming after you. I mean, we've seen it. It's medicine, like we have a target on us because everybody thinks we're either evil or everybody else thinks we're gods. So for the most part, why get into those? Why fall into any of that? Create a health coaching brand, create a telemedicine brand, and create a healthcare consulting brand. And the health coaching thing is complicated. It is not easy to set up, but there are people like Ray, who I've mentioned before. He's another attorney that I have on my LinkedIn, and I've mentioned him in my, if you go on digitalnomadphysician.com, you type in legal, he comes up as one of the physicians. He helps you create stuff so that you can work around the whole telemedicine thing. Again, there's nothing magical about it. He doesn't have a monopoly on this information. It's just that you cannot engage into the practice of medicine, right? That's it. And this other gentleman that I just mentioned, the other attorney, whose first name I also now forgot, I'll link it below. He's also great because he'll also help you set that stuff up. So that's it. I didn't think I had to mention that. I really didn't think I had to mention that. But yeah, it's not worth it. For what? If you want to practice medicine, practice medicine. So I hope that's helpful. Take care, guys.